It is June 13th. A lot has happened in the last 2 weeks, so I'll try to go over everything quickly. So two weeks ago, I met with Dr. Tierney, my surgeon. She kind of went over the procedure. I was supposed to have an MRI that Monday before. Complications arose. They had to change it to that Friday. I got a call the day before on Thursday, and they said that my insurance denied it, so no MRI. So meeting with the surgeon, not exactly flying blind, but didn't have as much information as she would have liked. She said, she palpated me and did a physical exam and said that based on how she can tell, it seems like it went down from 5 centimeters to 2 centimeters. So a chemotherapy did have a good effect, and it's kind of moved back closer to my chest wall instead of so far anterior. So that means I can have a skin-sparing mastectomy, which is good. They are still going to take off the nipples to do it. She said that if I really wanted, I could do the nipple-sparing mastectomy. Well, she kind of put it up in the air that either way. Just based on the information and the possibility of the skin of the nipple sparing failing. So when they do the nipple sparing, they do this, they cut you open underneath the breast tissue and kind of flip everything up this way. The nipple sparing, they just cut off nipples and go in through that way. So when you do the nipple sparing, nipples need a lot more blood, so there was a chance that they wouldn't get enough blood, they'd die, and then I'd have 2 big scars because they'd have to take them anyway. So just decided to go with it, and since originally it was so close to the surface and it started in the ducts, I felt like I would be more at ease to just have that all removed, so this never happens again. That's really one of the biggest deciding factors for me. I just don't want to have to do this again, so just take it. Reconstruction should be able to give me new ones. So she scheduled surgery for the 24th. She wanted to give me a little time to kind of still recover from chemo because I'm still having symptoms. I'm still not up to par. I mean, it's been a lot better, but today I was having trouble off and on. So it just kind of depends. It's all definitely getting better, but I still have days where it feels like I'm still doing chemo. So, and that's because it's still in your system. So they said it would take several months before the symptoms really started going away. So let's see, what else did she say? She gave me, a packet of information that kind of goes over all the, I've got all my forms in here. It's got my surgery information, so I know the time and the date and who's doing it. So each part of it is scheduled for a different time. So I will be arriving at the hospital, checking in at 8:30. And surgery should start approximately at 11. Surgery should take, she said, 4 hours. So, and that's, when everything goes smoothly. I will definitely be spending at least 1 night in the hospital, possibly 2. So, it just kind of depends on how the surgery goes, how the pain is managed, if I'm able to kind of move and take care of basic needs for myself, okay, then they'll let me go home. So after surgery, when I wake up, I'm going to have 2 scars each side. All the tissue inside, the skin here is going to be gone. So it's going to be like, it's all going to be bandage, of course, for the first week at least, I think. And she said, but it's going to be like having deflated balloons on your chest. So, okay, I mean, it's hard to imagine. I'm sure it's going to be visually disturbing, but it's part of the process, and there really isn't a whole lot I could do about it. I do get to have immediate delayed reconstruction, which means, there's 3 ways they can do reconstruction. They can do immediate reconstruction, which means the plastic surgeon is in the room, with your regular surgeon, and as soon as Dr. Tierney would be done, the plastic surgeon would take over, put the spacers, and start her whole process. But because we didn't do an MRI and I don't have a final pathology report, when they do surgery on me on the 24th, they're going to, you know, send tissue samples and stuff over to pathology, so they're sure they got it all. They're going to make sure it's not in my lymph nodes, because we, you know, we couldn't check. We couldn't do the MRI, so. Dr. Tierney seems very positive. She thinks that we're not going to find anything. She thinks it's all, you know, now localized, and once we get that tumor out, I'm going to be good. But you never really know for sure. So we have to do the pathology, and I have to delay reconstruction for 2 weeks. So it's not a real big delay, but that means I'm going to be under anesthesia again 2 weeks after the 24th to start reconstruction. So if they find something in the pathology, hopefully not, but if they do, then I have to, you know, consider what other treatment we're going to have to do. I could, most likely they're going to want to do radiation. I told them I've already decided I don't want to do radiation unless something really, you know, the pathology could come back, oh my gosh, it's here and it's this, and, you know, when it's life-threatening, when you're pushed in a corner, of course you're going, you know, instinctually you're going to make the decision that's going to make you live longer, but unless they find something like that, I'm not going to do radiation. So, but if I have to, for some reason, if worst case scenarios, they find something horribly unexpected and not good, I would have to do radiation for, I think she said 6 months, and then I have to heal for a while, and then I would do reconstruction. So it would be, oh yeah, it would be 6 months total before I could start reconstruction. Yeah. So I'm really hoping that that does not happen. So, so yeah, when I come out of surgery, I will definitely have, I will have, you know, deflated balloons. I will be all bandaged. I'm going to have drains, which it sounds like the drains are going to be the worst part. There's literally going to be like hoses that come out of my skin to these two little bags. And she showed them to me, and unfortunately I don't have any to show you right now, but I will when I get them. They look like little empty grenades. They're plastic. They have a tube that will go up into your body, and you squeeze them so they're, you know, empty of air, and you cap them, and then they kind of create a suction. So they just suck all the fluid, because I guess your body's natural instinct when, you know, tissue is removed or has an empty cavity is to fill it with fluid. So we have to drain all that fluid off. So that's what those things are for. And as they, you know, collect the fluid, I have to empty the fluid out, you know, every day or 3 times a day or something like that. Every time it gets to a certain level, I have to empty it, and I have to record every day how much fluid comes out, because once it gets to a certain level, then they remove the drains. So, and I guess that's just the worst part of it. They're really uncomfortable. They're inconvenient. They're just, nobody likes. Everybody says that the drains are the worst part. So. But it's part of it, so there's nothing you can really do. She also was telling me that along with clear fluid, you'll also get bits of tissue and clotted blood, and it will be really, really nasty. So, like 3 times a day, I have to sit and like strip the lines. So the hoses that come out, I have to like run my fingernail down and strip nastiness out of it so it doesn't clog and prevent them from working or something. So. They just really sound like they're going to be the worst part of that. It's nasty. So, yeah, that should be fun. And I can have the drains in anywhere from 2 weeks to, I think she said 4 weeks is usually the longest you have to have them. So, and the way reconstruction works too, I guess that can kind of change that. So, I don't know, I guess we'll see. But, yeah, so that was the meeting I had with her. So like I said, she set me up for surgery on the 24th. I check in at 8:30 in the morning. Surgery should start at 11. I should be in surgery 4 hours. I will spend that night there and maybe the next night there in the hospital. So that's where we are on that. I met with the plastic surgeon today. She is very bubbly, very touchy-feely, very much knows her stuff. She's been doing plastic surgery a long time, and she is actually a patient. She had a really aggressive breast cancer and had to have a bilateral or double mastectomy, and she's had, you know, bilateral reconstruction. So she really knows, and she's very, very aware of your body image, and you know, it was really interesting because she makes you disrobe, or has you disrobe. She marks you with this little marker so she can take measurements and kind of see where you are now. And because the tumor has come down 3 inches, this breast is now quite a bit smaller than this one. So I didn't realize that they had changed that much, so they're not symmetrical at all anymore. And she said that I also have a little bit of scoliosis, which, I mean, someone had told me that when I was, I think, in grade school, but they said I'd probably grow out of it, but I guess I still have a little bit, and it causes my rib cage to be a little distorted, so my rib cage sticks forward a little bit more on one side, on this side, so it makes it look like there's a huge difference here. I guess this is something she can kind of correct. She says that when it's all said and done, they won't be twins. They won't be exactly the same. They will be more like sisters. She said she gets it. She's really good at getting it very, very close, but they are never perfectly symmetrical. Not in nature, not even after plastic surgery. So I have to be prepared for that. So, but she, like I said, she took lots of measurements and lots of pictures and asked questions, answered questions. She felt like that the delayed reconstruction was a good opt for me, and she said, I definitely, we definitely want to see what that pathology report said. She says, I respect that you don't want to do radiation, but if it comes back, worst case scenario, and you've got some other kind, or, it's in your lymph nodes, it's aggressive, then you're going to want to do some, because your life is more important than... And she's right, but, like I said, unless it's the worst case scenario, I still don't think I'm going to do it, but we'll see. She also gave me a packet of information. It's all very formal. My measurements are in here, and my height, and my overall goal. And she put a really excellent timeline in here for me, which I'm so glad somebody finally did this, because this I like. So she says, okay, so you'll have the mastectomy, the double mastectomy on the 24th. 1 week later, I will meet with the plastic surgeon and have a pre-op appointment. She will kind of look at how everything's healing and make sure the skin is still healthy, and, kind of do a pre-op assessment. And then a week after that, I will have my very first, reconstruction surgery, where they will put in the spacers. And I guess the spacers they end up being, they're not going to be anything like breast tissue. They become hard once they get, start getting full. They don't have any, bounce feel or anything. They're very firm. But she said, my goal is not going to be about making you a certain cup size. She said, all your breast tissue has a footprint, or like a foundation. And if you make a house too big on a foundation, it doesn't work. If you make a house too small on a foundation, you see the basement. So she said, what we're going to do is we'll put the spacers in, we'll make sure they fit the base of the spacer fits your foundation. So I guess they have different sizes, and when they have me open, then they'll actually make sure it fits my shape, my body. And then, I have to heal. They'll put a little bit of fluid in them, and I'll heal. And then a week or 2 weeks later, they'll start adding fluid to it. And she said, and then we just keep adding fluid until they're the size that you feel that's normal, that's comfortable, that you're happy with. She said, you may come in and go, no, I think I want them bigger, we'll make them bigger. You'll come back in and be like, no, these are too big, we'll take them down a little bit, and then we'll have where we need to be. So she said, she said, I'm not going to guarantee you a cup size, because that's for bras, that's not for people. So you will have the breast that you're comfortable with. So whatever size that you're happy with, once it gets there, that's the size that you will be. So people are going to keep asking me, how big are you going to get? What size are you going to get? I guess I won't know until I get there, So that's kind of cool, though, that it's going to be that much about what feels comfortable and right for me. After 3 months from, the initial reconstruction surgery when they first placed them, then I'll get the actual implants in. And she says, depending on how my body reacts, sometimes your body will try to put some fat back in that area, and then sometimes you'll lose weight. Depending on what happens, she may take fat from other parts of your body and kind of fill in, so it slopes naturally and doesn't just pop out. I'm sure everybody's seen really skinny women with boob jobs, and it's just like, looks like they have a beach ball stuffed under their skin. That's not the goal. She doesn't want me to look like that, and I don't want to look like that. And so after 3 months, the implants go in, and then 3 months, I guess there's tweaking after that. They may have to be like adjustments to move things over. She said that we'll have to do some tweaking. Once the final implants are in, for 3 months, they'll be healing and tweaking, and then after another 3 months, they'll do the nipple reconstruction. So it's going to be at least let's see, 6 months, 7 months before it's all done. So it's still a long way to go, but I honestly felt like the chemo was the worst part. And now that that's over, I feel like I'm gonna handle this one better. So that could change though the day I come out of surgery. I don't know, but I'm feeling good and confident right now. So right at while you got it. Oh, another, you might notice that there's a different background behind me. Another thing that happened the last 2 weeks is I moved. Our rent in our apartment in North Seattle was going up. It was like a 700 square foot apartment, and my boyfriend's brother's girlfriend knew somebody who was renting a house up in Linwood that was pretty much the same price as what we were paying in North Seattle. So thanks to all the wonderful, amazing friends I have, we got moved within a week, and everything's here, and the apartment's all clean and closed out. We turned in the keys yesterday, and yeah, now we're just kind of trying to unpack and settle in before I have surgery in a week and 3 or 4 days. So it's a lot to kind of all take in all at once, but it's good, I think. So yeah, that is where we are today. So thank you again to everybody, especially all of those who came out and helped us move and cleaned up for us, and just everything. You guys are just absolutely fantastic. I love you all so much. It's just been the best ever. More pending. I'll keep you all posted. I intend to try and take some video on surgery day, you know, kind of going into the clinic. You know, I don't know how much they're going to let me use the camera, but I intend to try and take some. I intend to have somebody there with the camera when I first come out of surgery, just so, you know, everybody, other cancer patients that are watching this and other family can see, that I made it out okay, and you can kind of see what it's like when you first come out of there. So that's what's to go.